like to thank the Congress Sommeref, the Moroccan Society of Aesthetic Medicine and Regenerative Medicine, as well as Dr. Zeki, her team, as well as Skin Tech Pharma Group Morocco, for their kind invitation for me to come here from the United Kingdom. So just before we go into our slides, I'll just give a brief background because my talk is about asymmetry, how we deal with asymmetry. But first of all, we need to look at the point, the notion of symmetry itself. Throughout history, humans have strived to design, to construct monuments, ancient monuments as well, with a kind of symmetry as much as possible. There is an attachment when it comes to symmetry and the notion of beauty and the notion of perfection. Taj Mahal, as we have it, has two axes of symmetry. The Eiffel Tower, more modern, another two axes of symmetry. You have in Casablanca itself the Hassan II Mosque, which hopefully I will get to see on my trip. Again, has two axes of symmetry. And many Islamic motifs have also got symmetry design behind them. And then that is extended to facial symmetry. We have the golden ratio and how we define symmetry and the attachment we give to beautification and the idea of perfection when we try and create symmetrical faces. We know from our patients as practitioners, when the patients come to us, they want that symmetrical face. And we as practitioners are striving very hard to design, to harmonize the face. And we've already had a number of talks today, how we harmonize the face and create symmetry. So actually, asymmetry is very common. We know that from the patients that we see. There are a number of causes for symmetry itself. We're talking about congenital disorders, acquired disease, traumatic events, road car accidents, etc., as well as developmental deformities. So when it comes to things like seeing our patients and having consultations, it's extremely important to be able to determine a very thorough patient history. We need to carry out a very thorough physical examination, and where available, we need to have medical imaging when we can. In terms of the components of facial asymmetry, we are looking at soft tissue changes, dental malocclusion, as well as skeletal differences in terms of the supporting structure when it comes to the actual soft tissue changes that we are seeing. Most facial asymmetry is actually embryonically and genetically predetermined and encoded. We see that much later in life as we go on, except for traumatic external events that we have no control over. There is a general consensus when it comes to studies. We have generally, when we look at ourselves, a lot of you will be doing that in the audience, where facial asymmetry is more often common on the left side. And it is due to the left-right tooth crown difference in terms of measurements that we can see microscopically, or when we examine the measurements. However, macroscopically, we don't generally see that. And it's a point when our patients come to us when we can certainly determine whether there is a normal and then the abnormal. And then when the patient comes, it's their sense of imbalance and our sense as clinicians as balance. And then we have that information exchange. We look at their expectations, and we basically carry out a thorough assessment. Most forms of asymmetry are when we go much further down in the face. So there has been a nice study that's been carried out by Javed and Profit, and that reported frequencies 5% in the upper face, 36% in the mid face, and 74% of the population that was studied in the lower face. How many of you are actually using RRSHA long-lasting? If you can put your hands up. Okay, a fair few of you. And how many of you are using it in facial asymmetry? Not many. And there's a reason why, and I'll explain that as well. You can see from this slide, we are determining the level of facial asymmetry, and we go from normal, where we have the root mean square deviation of 0.65, and we're going all the way down to the right-hand side, where we've got extensive, significant facial asymmetry, fibrous dysplasia. RRSHA long-lasting is a fantastic product, and I'm here not only for this talk, but later on I will be doing a live demo and we'll be seeing the extent of the changes that can take place. But when we are using this product, we can only really go up to hemifacial microsomia. Anything more significant when it comes to facial asymmetry, we are going to use our traditional, much heavier hyaluronic acid proper fillers. RRSHA long-lasting, just to remind ourselves, is a skin builder. So it sits very much in between skin boosting and fillers itself. And there is a subtle change that we can make with RRSHA long-lasting, and that's where we manage to balance the disharmony between the patient and what they see and what we as clinicians see as well. A lot of the times we talk about protocols. When it comes to facial asymmetry, we are looking at personalization and going slightly away from protocols where we are seeing the patient as an individual and we are treating them individually, seeing where the asymmetry lies, seeing where their expectations are, and how we can match them as best, but also being honest with our patients as how far we can carry out the treatments for them. So when it comes to using, this is very specifically about RRSHA long-lasting, the usual way we do it, we sit the patient down and we first lie them down. Lie them down horizontally, assess the facial asymmetry, and then we treat that asymmetry, sit them up in the vertical position. We have two positions basically, and then we reassess and carry out treatment, but again, using personalization. You can see from this video, we are carrying out personalization, first of all, in the horizontal position. The usual protocol, which we'll talk about just a bit later, is 7 injection points. But you can see here, there are more than 7 injection points. We are injecting intradermally and subdermally in a very controlled manner. And we are injecting 0.1 to 0.3 mils, depending on the amount of facial asymmetry we have, the depth of the asymmetry, and how deep we can see the asymmetry itself. So as we mentioned, we are going at subdermal and intradermal depths, and it's a controlled process of injections, and we then do the second position vertically. And you can see here immediate before and after picture, and you can see that there is a correction, but there isn't 100% correction. And again, this boils down to the patient expectations. You can see here how the nasolabial folds have improved, but there is still heaviness on the left-hand side of the patient. The mid-face volume has also improved, and there is more of a matching. And as long as we are honest with our patients, we know exactly what our product can do and how far we can go. Most of our patients are actually happy with the results. Now, we can combine treatments. A lot of our talks today are about combining treatments to optimize the results. Here we have RRSHA long-lasting, which is our skin builder product, and we can combine it with the Hyalift 75 Pro. This is part of the Spanish Glow protocol you may know of, and that will harmonize the face, lift it even more gently, and give a much longer lasting result. And then for those who are more significantly asymmetrical in the face. You can combine treatments, again, using your traditional hyaluronic acid, heavier cross-linked fillers, using the RRSHA long-lasting, which is BDDE cross-linked, but a much finer filler, if you want to call it a filler content, but it is a skin builder. You would do this possibly 1 to 2 weeks apart, where your first treatment is for the heavier filler, much deeper, and then we can go a bit more superficially with the RRSHA long-lasting 1 to 2 weeks later, and the results are much more significant and longer-lasting, and they work synergistically together without any interference. So, just to conclude, with RRSHA long-lasting, yes, you can treat subtle, soft facial asymmetry, and match patients' expectations. If we are going to combine treatments, we are going to treat much more significant levels of facial asymmetry that we need to. Thank you very much, and I look forward to seeing you later on today, where I'll be carrying out a live demo with RRSHA long-lasting, both in the face as well as in the back of the hands as well. Thank you.